Over to Washington now, where President Biden is in isolation again after testing positive for COVID-19 over the weekend. The president appears to be over his COVID infection after testing negative last week. He appeared to be, rather. His doctor calls it a rebound case, which can happen in patients who have been treated with the antiviral drug Paxlovid. Major Garrett is at the White House with more.
Well, good morning, everyone. The president says he's feeling fine. His physician says he's experiencing no symptoms. But as everyone knows by this stage of COVID, each positive test result is disruptive, and the president's schedule has been disrupted. And of course, all of this has cast a presidential spotlight on rebound cases. In a Twitter video on Saturday, President Biden announced he tested positive again.
I'm feeling fine. Everything's good.
The president tested positive on Sunday as well. His physician called it rebound positivity. The rebound came after negative tests Thursday and Friday. In a small number of cases, patients can rebound after taking the antiviral Paxlovid, as the president did for the prescribed 5 days. Paxlovid reduces the risk of COVID hospitalization. It does not eliminate the virus.
In the clinical trials of Paxlovid, less than 10% of people experience a rebound of symptoms or test positivity after completing their course of Paxlovid.
While testing positive after taking Paxlovid is rare, Biden's chief medical advisor, Dr. Anthony Fauci, did so last month.
Paxlovid may not cure you. You may still have a rebound of symptoms or test positivity, but it worked if you did not end up in the hospital.
President Biden is not receiving additional treatment for COVID and has gone back to working in isolation. As cases linked to the BA.5 Omicron variant of COVID continue to rise nationwide, Dr. Celine Gounder recommended Paxlovid to reduce risk.
Far too few people in this country are accessing Paxlovid than are eligible. Upon completing that 5-day course, you should test yourself and see if you remain infectious to others.
The president is experiencing none of his original COVID symptoms: low-grade fever, cough, runny nose. He had 6 close contacts before that positive test on Saturday. All have tested negative, as has the First Lady, who's tested negative throughout the president's experience with COVID. And as recommended, the president will await 2 negative tests before resuming full duties. Vlad and Anne-Marie.
All right, Major, thank you. We want to bring in Dr. Mark Kline to talk a little bit more about the president's COVID diagnosis. He's the physician in charge at the New Orleans Children's Hospital. Thanks for joining us. All right, so explain this whole rebound case situation, and why does it sometimes happen with people who've been treated with Paxlovid?
Well, I'll do my best. First of all, I'll tell you what we know with certainty, and that is that if you are at high risk for severe disease from COVID, if you're elderly or if you have an underlying medical condition, Paxlovid is quite effective at preventing hospitalization and death. It will keep you alive and it will keep you out of the hospital. What is less certain is whether Paxlovid is of benefit to low-risk individuals or to those who are vaccinated. If you're fully vaccinated, the vaccine does essentially the same thing. It helps to keep you out of the hospital and alive if you come down with COVID. So rebound, we don't know whether rebound occurs despite Paxlovid or maybe because of Paxlovid. But in either case, these rebound cases that occur 2 to 8 days after a course of Paxlovid tend to be very mild. Sometimes they're entirely symptom-free. That's just a positive culture. And then they resolve uneventfully. So it typically is not a big deal for the individual patient, except that when the rebound occurs and when the patient is shedding virus again, potentially they might be infectious and could transmit the virus to other people. So they need to go back into isolation.
So is the president still contagious now?
Well, I think we need to assume that he is if his cultures are or rather if his tests are positive. I think we would assume that he is. There are not hard data to document that, but if someone is shedding virus and if they are test positive, I think the safe assumption is that they are potentially infectious.
So then, do you agree with what Dr. Gounder said in Major's piece, that more people should actually be taking Paxlovid, despite the fact that there's a chance of having a rebound case?
Well, people who are older.
Right? Yeah. Because I think those are only the people who are being offered it now. Sorry, doctor, go ahead.
Yeah. Yeah, no, I certainly do. I'm an advocate for Paxlovid. I think particularly in older people over the age of 60, people who have other medical conditions that put them at high risk for COVID, I think Paxlovid absolutely is a safe drug and is a drug that can keep them out of the hospital and will keep them alive. So in those situations, I absolutely do recommend it. And I think for unvaccinated individuals who are younger, it should be very strongly considered. And even for those who are vaccinated and boosted, there are some limited data to suggest that if your booster dose, the most recent one was more than 5 months ago, you might benefit from Paxlovid. So there are a variety of circumstances. These are conversations that patients have to have with their doctors and come to a decision in every individual case. It's hard to give, an absolute or hard and fast answer that would apply to absolutely everyone.
Doctor, before we let you go, just so I understand the science, when we say someone has been reinfected with COVID-19 after taking Paxlovid, does that mean that they came into contact with somebody who infected them again, or did they somehow, was there a resurgence of the virus inside of their immune system?
Like it wasn't a true negative
right,
when they tested.
I guess, yeah.
Yeah, so Vlad, when we talk about rebound, we're not talking about reinfection. We're talking about a resurgence of the virus that is already in that patient's body. So, while the Paxlovid is on board, while the patient is taking Paxlovid, the virus disappears for a period of time. And then a few days after discontinuing the Paxlovid, suddenly the test is positive again, and the patient may have some mild symptoms. That's a resurgence of the virus that is in the patient's body. We don't know that Paxlovid is causing that. It may just be happening despite the fact that the patient had 5 days of Paxlovid.
Yeah, it's good to clarify because I think some of the headlines, the way they were written over the weekend is the president has COVID again. Reinfected with COVID. It's not really a reinfection. Yeah. It's almost as if the virus really never went away. And it's true that people continue to test, if I'm not mistaken, doctor, people who have had COVID continue to test positive on PCR tests, even though they test negative on antigen tests. And that's why oftentimes it's not recommended to have a PCR for 90 days after you've had COVID, because you're still going to somehow show up as if you are COVID-19 positive.
That can be true as well, Vlad, absolutely.
Yeah, all right. Dr. Mark Kline, always great to have you. Thank you for making us smarter today. Appreciate it.
Great to see you.